a cataract is a lens of the eye that turns brown and cloudy as we get older. So it happens to everybody, starts when you're born and grows and grows throughout life. So everybody gets a cataract sooner or later. Most patients, by the time you're in your 60s or 70s, are going to have a cataract. Some patients get it sooner, some patients get it later. So as a cataract grows, it affects the vision. It makes things blurry. At the beginning, you might just notice a little trouble reading at night, dim lighting. The other thing that a lot of patients have is trouble driving at night, glare, headlights, or driving into the sun when it's low. Things like that can start to give them trouble. Contrast is also a problem sometimes. When you're looking at things that are gray on gray or red on brown, things like that may become more difficult to see. When you start to get a cataract, in the early stages, sometimes just a change in prescription will help. Your prescription may need to be a little stronger. It may need to be changed more often. But as long as we can change the glasses and you still see okay, then that's all that needs to be done about it. So if you're at the point, though, where you start to have too much trouble with the vision, especially if you start to have trouble driving or reading or doing things that you want to do, then we need to start thinking about surgery. Most patients know when it's time for surgery just because you're not happy with the vision. If you're getting along fine and your vision is great, you can do everything that you need to do. Even if there's a cataract there, we usually won't do anything about it. But if you're at the point where you're struggling, you're not happy with the vision, you just need to see better, then if it's from a cataract, then it's time to start thinking about surgery. The first decision to make really is it bad enough to do surgery at this point? And this is something that you generally have to decide. Once in a while, if the cataract is real bad, even if the patient isn't complaining about it, but it's causing other problems like the pressure in the eye to go up or keeping us from being able to examine the inside of the eye, we might want to take your cataract out, even if you don't think it's that bad yet. But for the vast majority of patients, we take it out when you think the vision is starting to bother you. So the first decision is really, is it bad enough to warrant surgery at this point? And if you're having trouble doing things that you want to do, if you just feel you need to see better, then surgery is certainly an option. But there's usually no rush to do it. It's something we can do later. We can hold off until it gets worse if you're not that bothered by it. It's not an emergency. So this is an elective surgery. So first thing to think about is just really whether the vision is bad enough that you want to fix it at this point. If you want to wait, that's fine. We can keep an eye on things. We probably want to check it every so often just to make sure it doesn't get too bad. But again, there's no rush to do the surgery. Cataract surgery is pretty easy. Something we do all the time. It's pretty routine. Basically, we take the cataract out, which is your old lens, and we put a new lens in there. So it is surgery. We have to go inside the eye. We can actually take the old lens out by dissolving it with a little ultrasonic instrument. It's a very small incision, about 2 millimeters. And then we put a new lens in there, which is a replacement for your lens. We actually roll it up and tuck it into the eye through the same small incision and unfold it inside the eye. And so you get a new lens to look through. A lot of patients think it's done with a laser. It's actually not done with a laser. The technical term for the ultrasound is called a phacoemulsifier. So it's a long name. It's actually ultrasound, but some people call it a laser. It's not really done with the laser itself. There are ways to do parts of the procedure with the laser, and sometimes we'll use the laser after surgery to do a little touch-up, but it still requires actual surgery. We're actually going in the eye and replacing the lens of the eye. We replace the cataract with a new lens called a lens implant. It's usually made of soft plastic, and again, we can fold it up and put it in the eye through the same incision we take the cataract out from. It's a good, clear lens. They don't wear out. They don't go bad. They don't have to be cleaned or adjusted. Once we put it in the eye, it's permanent. You won't feel it. You don't have to do anything about it. It'll last the rest of your life. Once the lens is in there, it's permanent. It doesn't have to be changed. Now, it could be changed once in a very rare while. If there's a problem, we can take it out and put a new lens in there, but that's very, very unusual. Cataract surgery itself, it's pretty easy. It takes about 10 minutes. We give you a little sedation, so you're pretty sleepy and groggy during the surgery itself. We have an IV in there, and we can give you medicine through there to help you relax. So most patients, it's over before they know it. You can go home and do things pretty normally that afternoon. The sedation we give you is very short acting, so most patients feel pretty normal on the way home. They can stop and eat if they want. You can go home and do most normal activities pretty much right away. We want you to be a little careful not to rub the eye and to keep it clean and dry. But other than that, most patients feel pretty normal within a day or so. The surgery itself doesn't hurt. There's usually no needles or stitches or shots involved other than the IV in the arm. We make the eye real numb just with drops, just like we do in the office, and there really isn't any pain involved. Healing is pretty quick after surgery. Most patients can do most normal activities by the end of the day or by the next day. It does take a couple of weeks to fully heal, and we don't want you to drive for the first day or two after surgery. It takes a while to get adjusted to the new vision. You'll be on some drops before and after the surgery that you'll be on for several weeks. And once it's all done, we usually need to make a little change in your glasses prescription. Most of the time, we'll wait 4 to 6 weeks after surgery before we do that. If you have a big change in the prescription, sometimes we'll change it the first week. But if you can get by without it, or the change isn't too big, we'll usually wait till that 4 to 6 week time point to get you new glasses. We'll have you on some drops before and after the surgery. One's an antibiotic to prevent infection, and the others are anti-inflammatory drops to help the healing. They reduce the swelling, prevent any pain or discomfort, and reduce the redness and so on. So they're an important part of the healing process. Most patients can go back to work after surgery fairly quickly. If you work in a clean environment, depending on what you do, if there's not a lot of dirt or a lot of potential trauma to the eye, most patients can go back to most normal things like that within a few days. If you're working outdoors or in a wet or dirty environment, you might need a little bit more time off of work. Again, it depends on your specific situation. Sports, kind of the same thing. Golf, a lot of patients like to golf after surgery. That's usually pretty clean, and as long as it's not too windy or dusty, patients can usually golf within a couple of days after surgery. Things where you might get hit in the eye, like tennis, we usually want you to have some eye protection on, and you might want to wait another week or two before you get back to things like that, where you might get hit or bumped in the eye. Things like swimming or scuba diving, we'd probably want you off for several weeks. The surgery is very quick and very easy for most patients, but it is surgery, so there's always some risk involved with any kind of operation. The surgery is very successful. 98 to 99% of patients will get back to normal vision. You may still need glasses, but 98 to 99% of patients will get a good result and get back to good vision after surgery. The odds of a serious complication after surgery are about 1 out of 1,000. Those are things like an infection or major bleeding in the eye. Fortunately, very, very rare. When they do occur, a lot of times we can still fix them. But this is surgery. There's a small chance that there can be problems that could cause the vision to be worse afterwards, or you could even lose the eye. Again, we take all the precautions we can to try and prevent that. This is one of the reasons why we don't do the surgery if you're not having any problems. But once a cataract is starting to affect your vision, the odds are pretty good that you should do fine. We also know that if we don't take out the cataract, it's only going to get worse. So once the vision is bothering you, usually the risk versus benefit ratio is pretty good. There's also a % or two where the vision may get better, but not all the way, or may not improve. Usually that's because we discover some other problem in the eye that we may or may not have known about before the surgery, or that may come up after the surgery. Things like macular degeneration or glaucoma or things like that can still develop after surgery. So nothing's 100% successful, but again, the odds of cataract surgery helping you if the cataract is bothering you is very, very high. If the cataract isn't at the point where it's bothering you too much, a lot of times a change in glasses will help. Sometimes we can help the glare symptoms with a tint in the glasses or a little coating on the lenses to reduce some of that. There really aren't any other options, though. There's no medicines or drops that are going to stop the cataract. It's going to get worse. So sooner or later, when it bothers you enough, then it's time to take the cataract out. A lot of patients with cataracts will also have glaucoma. Cataract surgery usually doesn't make the glaucoma worse. Once in a while, the pressure can be a bit higher right after surgery, but in the long run, most patients with glaucoma will see an improvement in their glaucoma once the cataract is gone. If the cataract's real bad, we may want to do glaucoma surgery at the same time we take out the cataract. That's also an option. But depending on how bad the glaucoma is, that may or may not be necessary. That's something we'll have to decide with each individual case. It's not unusual to have other problems in your eye, things like macular degeneration, which is very common in older patients. that can affect the vision after surgery. So sometimes even with perfect cataract surgery, the vision may not be 100% better, but usually there's at least some improvement, and it doesn't make these other problems worse. These are other things like macular degeneration still need to be monitored and taken care of after surgery just like they would before, but the surgery itself doesn't make it worse. Medical conditions like diabetes and high blood pressure usually aren't a big problem with cataract surgery as long as they're under control and stable. Even patients on blood thinners, we can do surgery without stopping their blood thinners because the risk of bleeding is so low with this. So it's really a pretty easy surgery in terms of the medical significance. Most patients will have cataracts in both eyes. That's what you would expect since both eyes are the same age. We don't like to do both eyes at the same time. Again, our main concern is infection, so if there was an infection, we wouldn't want to have both eyes be affected by that. So we like to do one eye. We usually wait at least a week or two to make sure things are healing and there's no infection and that things are going along the way we expect them to before we do the other eye. There are different types of lens implants that are available depending on what your eye is like and what your vision needs are. The basic, or what we call a standard lens implant, is a good clear lens. It'll give you good clear vision at one distance, and we can pick either distance or close depending on what you're used to. There are some special, more advanced lenses. One of those is called a toric implant, or a toric lens. This is a lens that corrects astigmatism. Astigmatism just means that your eye is not quite round, it's more football shaped. And so to correct for that, your glasses have to have the astigmatism correction built into them, which creates some distortion in the vision. If you have astigmatism, you've probably had it all your life. It's something you're born with. We have special implants now, these toric lenses, that will correct the astigmatism inside the eye. And so we put this lens in the eye, we orient it in the right direction to compensate for your astigmatism. And by doing that, we can minimize your need for glasses correction after surgery. This is a good option for most patients. Astigmatism doesn't do anybody any good. It just makes your prescription worse and creates some distortion. So it is a nice option to be able to correct it inside the eye at the same time we take out the cataract. Another thing that patients complain about is what we call presbyopia, which is what happens as we get older and the eye loses the ability to change focus from distance to close. We have implants now that can correct for presbyopia. One of these is called a crystal lens. This is a flexible lens that actually changes focus so that we can set it so that you see distance vision, and then when you want to see close, your eye muscles can act on it to help it bend and change the focus for close. So it's almost like having a younger lens in there. It has some limitations. It's not perfect. It's not like being 20 years old again. It's probably closer to being 40 or 45 again. But it does give you the chance of being able to change focus from distance to close like a younger patient and not be as dependent on your reading glasses or bifocals as most patients are as we get over 40. Another option is what's called a multifocal lens. This is another type of presbyopic lens that actually has two focal points. It gives you distance vision as well as close vision. It takes a little bit of training to learn how to use it. The brain has to adjust and learn how to use the images so it can pick out the distance image and the close image. But this is another good option that some patients really like because it gives you the ability to function without glasses for the vast majority of things. None of these implants are perfect. I don't like to promise any patient that they're not going to need any glasses after surgery. Even with the presbyopic implants, some patients will need some glasses for reading real tiny print or reading in dim lighting, or reading for a long time, or driving at night, seeing detail in the far distance, things like that. But these new lenses do give you more independence from the glasses and the best range of vision that we can give you without needing the prescription. So they're a good option for some patients. You have to have a pretty good, healthy eye for this to work for you, and it depends on the other measurements of your eye and the rest of the health of your eye, whether you're a good candidate for it or not. But if you're a good candidate, they work very well and they give you the opportunity to really reduce your need for glasses. Depending on your eye, it's my job as a surgeon to help you decide what type of lens implant is good for you. It depends on a lot of factors: the health of your eye, the shape of your eye, type of prescription that you're used to, as well as the vision needs that you have. So this is something that's really individualized for each patient. But there are a lot of options, and if you're a candidate for one of these other more advanced lenses, that's something that we'll have to discuss once we've taken a look at everything and all your measurements and had a chance to talk to you about what your needs are. The nice thing is that it can actually make your vision better than it ever was before, rather than just getting it back to what it used to be before you had the cataract. One of the other things that we'll have to think about in terms of the type of vision you want after surgery is whether we want to keep you nearsighted or aim for more distance vision. Some patients who are nearsighted all the time prefer that, and we can certainly keep you nearsighted after surgery with a new implant. Some patients prefer distance vision without needing glasses, so we can aim for that. Again, it depends on your astigmatism and the rest of the eye, but we do have the ability to try and target certain ranges of vision after surgery by choosing the implant of the right power. There is also the option that some patients like what we call monovision, which means making one eye better for distance and one eye better for close. This is another way to reduce your need for glasses by giving you a more range of vision without being dependent on your bifocals or reading glasses. Don't like to promise that any patient's not going to need any glasses after surgery. Certainly with a standard implant, you're probably going to need glasses for a lot of things. With the toric implant or one of the presbyopic implants, we can usually eliminate glasses for a lot of things. Most patients with one of these newer lenses will need glasses maybe for real fine vision or real far distance. But a lot of it depends on how you heal too, because we can't predict all of that. Some patients can still end up with any of these lenses more nearsighted or more farsighted than what we aim for. That can always be corrected with glasses. It's possible to change the implant if it was really way off, but that's pretty rare. We don't like to do that unless we really have to. It's also possible to have laser vision correction to fine-tune the vision afterwards in some cases. But in the vast majority of cases, if we get good measurements and things go the way we plan, we can usually come pretty close to the type of vision that we're aiming for. Cataract surgery is covered by medical insurance, just like any other medical procedure. You have a copayment or deductible, of course. Depending on the type of implant, certain implants, like these newer advanced implants, aren't covered by surgery because they're options. Nobody has to have it. They're nice because you don't need your glasses as much after surgery. Medical insurances will cover the basic or the standard lens implant, which again will give you good vision, but you'll need your glasses after surgery. If you're interested in one of these newer, more advanced implants, there's usually an extra cost involved with that the insurance may not cover. And that amount may depend on the type of lens you need and what else is involved. So that's something that we'll have to discuss once we see your exact situation and figure out what's best for you. Patients, especially with a standard implant, will usually need a new prescription once things have healed. Again, we wait about 4 to 6 weeks most of the time to change that. If you're going to have the second eye done, we may wait till the second eye is done before we do it. If your prescription changes a lot, we might want to change it as early as the first week after surgery. And we can do that, but it may be a temporary prescription that may need to be adjusted later on. Now, the other good thing is that medical insurance often will cover a change in glasses after cataract surgery. It's usually the one time in your life when it'll do that. So that'll help with the cost of the change in glasses after surgery. If you have a regular optometrist who changes your glasses, we usually recommend that you go back to them and have them change it just because they know what you like and they've been fitting you for a while for your glasses. But if you don't have a regular optometrist, we can help you with that as well. The surgery is done at the outpatient center. I use 2 different ones. They're both very good. Just depends on the day and the insurance and the schedule. We'll check on all that before we schedule it. But they're both very good. They have the same equipment. Both do a great job.